Hi, this is Sam Collins of the American Acupuncture Council. I'm welcoming you today to another episode of our ongoing Education for Acupuncturists and provided by the American Acupuncture Council, your malpractice carrier. My name is Sam. As many of you are aware, I'm the coding and billing expert for the American Acupuncture Council. I write the articles for Acupuncture Today, the call Ask the Billing Expert. We teach seminars all over, run the network so you can call in and have all your questions answered. But this episode really is going to be dealing with some new issues and trying to integrate acupuncture. So we're very happy to have for this episode Dr. David Miller. And I got to make sure to read this because this is a pretty long bio, but I think one that's very impressive. This is Dr. David Miller. He's an MD and an acupuncturist and is one of the only MD physicians in the U.S. that's duly certified in pediatrics and Chinese medicine through the NCCAOM. His practice is in East-West Integrated Medicine. It's located in Chicago, and he sees patients of all ages, but definitely deals with even pediatrics. He's designed a curricula for integrative physiology as an active participant and a leader of numerous state and national associations. He's the chair of the National Organization of American Society of Acupuncturists and the chair on the NCCAOM Committee on Biomedicine. He actively practices in Illinois, as I mentioned, or Chicago, and participates actively in the American Academy of Medical Acupuncture, the Illinois State Medical Society, and other state and national groups. And he is, I think, one of the experts, one of the ones I think kind of gives a nice perspective for all of us to understand from the medical side, but also how Chinese medicine or traditional medicine matches. So I want to welcome Dr. Miller. Thank you for coming to have some time with us.
Thank you, Sam. It's an honor to be here. Delighted.
Great. So it's really good. So here's what we really want to kind of focus on, because we know you do for pediatrics or children.
Great.
And so I want to kind of ask you, in your practice, what is your emphasis? How do patients come to you, and what do you see them for?
Well, so I'm very much a generalist, and I started out with my Western medical training, as you mentioned, in pediatrics. So did the full, medical school and residency training there. And the board certification in pediatrics is actually through the American Board of Pediatrics. And then I did the 4-year Pacific College program in Chicago and got my NCCOM certification. And so I've been developing an integrative and holistic practice since 2005. And I see all ages with a special outreach to the kids based on my background training, but do treat, the full spectrum. So sometimes I'll be treating adults and they'll refer families with kids. I'll be seeing kids and their families will refer others. I would say that primarily it's word of mouth referral for the practice. That's the most reliable way that people kind of come. And so there's that sort of longevity of being around and getting to know people and becoming part of their family care that then they hand me off to a friend or a family member as well. I definitely do some speaking and some teaching as well too, but I'd say for the practice, the individual referral is still the most powerful tool.
Well, certainly. So again, as most practices I think thrive on is getting patients who come to you, and that's going to be your best mode of integrating your practice, meaning getting more patients, is just by word of mouth. Absolutely. Now, when patients come to you, being that you are both an MD and an acupuncturist, do you think, are they coming to you because you're an MD only, or did you do acupuncture? Is it kind of because they understand you do both?
It's definitely because I do both. I mean, I think that there aren't very many LAC practitioners who are really comfortable and really make an effortful outreach to treat kids, especially in the Chicago area. There's very few people who are making that outreach. There is a growing number, and I'm trying to sort of help them along and help them to develop their practices as well too, because we definitely need more Chinese medical practitioners treating children. But a lot of times people will come to me because they're unfamiliar with holistic medicine, Chinese medicine, and they know I have the medical doctor background as well, and I think that gives them some comfort. I'd say the services that they're looking for, though, are not Western medical. Like they have their access to Western medicine. They're aware of most of their options within Western medicine. And so they're really coming to me for another perspective.
Right. So, I mean, they really are coming because they know you do some acupuncture. But Absolutely. In that sense, what would you say the percentage of your patients come in? Does most of your patients receive acupuncture, or at least that philosophy of care?
Right. Every patient receives integrative care, which always includes some aspect of Chinese medicine. I don't always do acupuncture, with everybody, and sometimes the kids are more or less receptive to it. Sometimes the adults are more or less receptive to it. I would say, though, I do a lot of Tui Na massage and the pediatric Tui Na as well, and so virtually all of the kids will get Tui Na treatment. I also do a lot of herbal medicine with children and families. And so that's also a big component of the care. So sometimes it's acupressure, Tui Na, herbal medicine, dietary counseling, lifestyle counseling, but it's always integrated into every patient visit.
Right. Yeah. So in other words, it's really an integrated practice in the sense that you may do acupuncture, you may not, but you're using the traditional medicine philosophy, whether it's going to be tuina or massage, but kind of that protocol as opposed to the Western. So now when a patient comes in and they're getting this service, is it something that obviously depending on what they have, but what would be the few common things that you treat or see most commonly, I guess?
Right. Well, I'd say gastrointestinal issues are a big one. There's a lot of kids with digestive problems. And then sort of along with that, from my perspective and many people's perspective, comes things like asthma, eczema, allergies. And so that sort of domain of issues is definitely a core component. Sleep issues is also a really common problem. And then sometimes emotional and behavioral issues as well. They're all sort of tied up with one another, but that would be the most common constellation of things that I see.
Well, I think it's interesting. I noticed of the things you named, I think most acupuncturists are fearful that I've got to treat pain. And clearly, I'm not saying you don't do that, but the common things you're treating they're not coming to you for back pain, like you said, emotional issues, eczema, right, asthma, and so forth. So I think that's also an area that I think acupuncturists may not have ventured in the areas that you can help someone with those, give a chance for it to work. Don't just focus that it's got to be back pain, if you will.
Absolutely. It's an interesting point. And I'm so used to treating sort of more of those internal medicine types of issues that, I mean, I definitely see a lot of people with pain syndromes, but, for kids, when I'm treating pain in kids, it's usually not the same, type of dysfunction that you'll see in an adult. Kids don't generally have slip discs. They don't generally have spinal fusions or spinal stenosis or, severe injuries like that. And so a lot of their pain comes down to things that can be managed through myofascial techniques and tuina massage and things like that as well too. I would say there's headache and migraine pain that I see fairly frequently in kids. But a lot of times also that does come down to musculoskeletal and sort of channel related imbalances. But absolutely, there's a whole range of things that really desperately need treatment. And people just don't know where to go for it to get that kind of holistic and integrative care. And Chinese medicine offers an amazing array of techniques to help manage those types of things.
Well, considering, as you just said, many times people are coming to you because they've tried the other route, I think certainly some of the acupuncturists listening may want to start to venture to let patients know that those are things that they can help them with. It's just a matter of the person understanding that, because clearly you're having people that have obviously tried maybe the Western side. They understand it's there. They're coming to you for something to be alternative, if you will.
Absolutely. Right. I mean, if they've got eczema, then they've been to their doctor and they've been prescribed steroid cream, but very few people will have talked to them about like the health of their gut, and the diet and how that fits into it. Hopefully they've talked to them about like, dyes and detergents and soaps, but virtually never is there sort of a holistic view of the patient's kind of global health and how the eczema may be just a manifestation of an internal imbalance. And instead they're being treated more symptomatically, which at this point, in this day and age, most of our families who, are even moderately educated and have access to the internet realize that that's not really the way to go. It's symptomatic control. Yeah.
I often have made a joke that for skin conditions, there are literally thousands of rashes, but there's 2 creams.
Right.
Clearly, if the creams work, they wouldn't be coming. But I think it's giving here. And I think this is what's important to note is that you have people that are seeking this, but yet may not be aware. So how do you think people come to you? Is it just a matter of them saying, hey, I've had a friend that's gone out? Because how did you start? Did you just, start introducing it to patients and then started referring? Obviously, you come from a Western background, but where do they start to integrate? How did you put it into the practice?
Well, it's a slow build to build a practice. It really is. And so, there's a certain realism people need to come into the field with, as they come right out of school and they want to build a practice, that it takes 3 to 5 years to build a solid practice. And it takes some footwork too. So I went out and I did a lot of community speaking. I did advertising. I did, like health fairs and things like that too. So I put myself out there and let people know what I was doing. And then it's always useful as well to have something that is kind of a specialty kind of thing that you're doing. So pediatrics is my specialty kind of thing to offer so that they could think, oh, not only do I want this service, but I want it for this reason. And I remember this person really offered this special kind of care. You don't want to box yourself in too much, but at the same time, there are certain areas that you might just really love to treat. And you can really say, I treat a general range of conditions, but, I'm expert in this, or I really love to treat that. And that gets people in the door and it starts the process moving. And then they, start referring their family and friends. And over time, it just becomes sort of an expansion exponentially of the number of people who know about you. And then oftentimes it takes people hearing your name from 2 or 3 different sources before they'll actually make the call. And so you just have to kind of, keep plowing forward and doing your footwork to get that base going, and then it starts to self-propagate.
Yeah. Well, I think it's important what you stated, that a lot of acupuncturists take heed. You're not going to come and blow the doors off your first year. It's a build like any business. It's going to be a build and go through. Now, one of the things I definitely want to ask you about, because you mentioned that, what about diet and gut? What type of products or supplements do you use to aid? Because sometimes, like you said, the kids are getting just, body work and other things. So what types of things do you use in your practice?
Well, I think it's really important to take that holistic picture. And one of the things I love about Chinese medicine is its emphasis on diet, lifestyle, and emotions as a constellation of things that you need to tend to with every patient. And so I really take that to heart, and I do tend to that with all my patients. And so thinking about diet, thinking about sleep, thinking about exercise, thinking about just exposure to nature as well too, as an important component of health. And so, with the patients I see, I do a careful diet and lifestyle history, and I try to look for areas that I'm seeing deficits. So the products that I end up using, I don't use a vast array of products. I mean, I do use Chinese herbal medicine, which is a very broad field, but you do end up using sort of a fairly constrained number of products because there are common things that present commonly, and then the other things you treat as they appear. But one of the ways I think about it too is, I try to do everything through diet, for example, if I can. But realistically, there are kids whose families, for whatever reason, can't get them to eat, say, green vegetables. So then you have to start thinking about, well, what are they missing in their green vegetables, and how do we get that into them? And we can try things like smoothies and try getting it in through that food route. But if we can't get it in there, then we need to start thinking about things like, what's their magnesium levels like? What are their zinc levels like? What are their B vitamins like? And all these kind of things that are missing simply because of the diet that they have. Generally speaking too, historically, we would have gotten plenty of sun exposure during much of the year, depending on where you live on the planet, too. So your vitamin D levels would have been tanked up. But in sort of the modern time, and certainly in Chicago from, about a month ago until May, we're not going to get enough natural sunshine to produce viable vitamin D. So you got to think about, how am I going to supplement vitamin D in this child, because they can't get it through nature. And generally speaking, their food sources are going to be inadequate. So there's things like vitamin D. Fish oils are a big one that I like to use as well in the practice. I think the exposure to good, healthy omega-3 fatty acids and that balance of fatty acid levels is vastly, out of balance in our culture based on our diet. And so a lot of families do benefit from that. And sometimes you'll see really dramatic improvements in things like asthma and eczema when you add in the fish oils. And then, the third sort of set of products that I think are really kind of cornerstones is the probiotics. And again, it comes down to sort of like, what's going on, where are we in history, and why do we need those products? Can't you just get that from eating right? The answer is, of course you can get that from eating right. Like, if you can get the kids to be eating fermented foods, sauerkraut, kimchi, raw yogurts, things like that, then you could conceivably do that without a product. But realistically speaking, families aren't doing that, and they likely won't do it. And so, using an array of products like that allows you to sort of make up for some of the deficits that you're seeing, while always trying to correct as best you can using whole foods, because you can never substitute for good eating.
Right. Well, I think it's interesting. You're indicating that commonly you're going, just let's first look at the diet and get this person eating a good diet.
Yeah.
Which is all well and good, but as we both know, always doing that is not so easy when there's processed foods and other things. So how we supplement. Now, you mentioned those. Are there particular products that you recommend over others? Is it something that they buy in the grocery stores? Is it something you sell directly?
Right. It's a good question. I mean, there are specific products or lines of products, but what I like to look for is really the quality of the products. And because different people have access to different brands and things like that nationally. So vitamin D and D3 really is the form I use, is pretty widely available. And it's pretty easy to get good quality vitamin D just in general. And so that's not so hard to come by. The fish oils, come in a wide array of quality. And so in fish oil products, you're really looking for products that have been appropriately tested to be free of things like contaminants and heavy metals and byproducts of manufacturing. And the other thing you're really looking for in those products is the concentration ratio, because you're looking for what's called the EPA and the DHA values in a fish oil product, because every product is going to say 1,000 milligrams of fish oil on the front. But if you turn it around on the back and you look at the EPA and DHA, you're going to see a wide range of inclusion of those versus other fish oils, which ends up just being, or other omega-3s, which ends up being just a filler oil. So I look for products where I can get sort of 1,000 to 1,500 milligrams of the EPA plus DHA within a half teaspoon to a teaspoon dose. And there's a number of companies out there that do make those. I don't know if it's appropriate to mention product names here, but there are a number of companies that will make those. And that's kind of what you're looking for, because with kids, it's always about like minimizing the volume of something you have to give, while hopefully maximizing like the flavor benefit. But flavor is pretty subjective. So, all the companies that produce these products try to make them lemon or strawberry or things like that too. And some of the kids are fine with it, and other kids you have to experiment. And then the probiotics are very temperamental. And so you never want to buy probiotics from an unknown source. I wouldn't, unless they're a shelf-stable product, I wouldn't order them online, particularly too, because you don't know if that person left them in their car, and sat in the sun and it's just dead product. So yeah, you're buying it and it's shipping to you and you're getting it at a bargain, but it may be kind of useless. And so I look for a product. For me, what I look for is products that are sort of 40 to 60 billion per dose and have 6 or more strains of the probiotic as sort of a baseline. And then, each practitioner will have to identify good sourcing for that. You can go to major retailers, some of the larger, natural food stores and things like that are pretty reliable in their stock. And so you can send families to those stores. There's also a number of companies, nutraceutical companies and the like, who make really good products that practitioners could stock in their offices. And so which one of those makes the most sense to do will sort of depend on where you live in the country and sort of who's available.
Good common sense, like you said, some of that is. So now when a patient comes in, you're obviously doing an office visit, you're doing a lot of counseling. What do you expect to see? Let's say a kid comes in with, say, some asthma or a skin condition, and you start changing the diet. What do you look to see? Is it something you look to see like within a week, a few weeks? What is the time frame you typically look at?
Right. Well, those tend to be a little bit slower to change. And also depending on like how long the condition's been present, how many factors are going into the imbalance of the child. So, if you really hit the nail on the head and you figure out sort of some of the underlying cause of the things and you start to alter them, you'll see results fairly quickly. And by quickly, in the case of like asthma and eczema, I mean a matter of sort of weeks to months. Not necessarily like in a day or two, because a lot of people have sort of intermittent symptoms. But if you have sort of a blood deficiency pattern, eczema, and you start nourishing that child with appropriate, substances, then you're going to see what you should see is you should see sort of a decline in the severity and intensity of their presentation fairly quickly, but you may not achieve full optimal results for a number of months, depending on how out of balance they were.
So it's going to be clear. You've really got to make sure to educate the patient and the parents as to what things to look for. And I guess understanding too, like anything, if you want to lose weight, you're not going to do it by dieting for a day. So it kind of fits the same thing. So I think that makes sense. And that's certainly a lot to deal with, because I think obviously when you consider the inundation of snack foods and other things available, it is very difficult in this age with advertising to probably do that.
Absolutely.
Now, with these supplements, is there any legal issues that you've run into as far as, what herbs you can, or ones that might be more problematic that you've had, particularly for an acupuncturist?
Well, and I think that's really the important point, is that I do have extra leeway as a medical doctor to use some of these products. And I think each practitioner has to look at the laws in their own state, and they should be aware of the laws about their use of dietary supplements and similar, and also to really be really cautious to only practice within your comfort of training level, that you should have training that lets you understand how to use these products appropriately. And I think it's very individualized that way. The other thing I generally like to encourage for Chinese medical practitioners is, when you're using these products, like I don't really like sort of the trend of moving away from Chinese medicine and using products in either sort of a functional medicine way or more like a naturopathic physician. Not that those are bad fields in any way, but people are trained as Chinese medical doctors, and you want to be practicing as a Chinese medical doctor. So I think you can understand the substances that you're using from a Chinese medical standpoint, and that helps both what you're expecting to see from them and when they're appropriate to use. So for example, fish oils in my view, really fall into the category of a blood tonic. And so when you're blood deficient, you have dryness, you have inflammation, you have sort of patchy eczema that's not that weepy, it's a little drier. People have a hard time falling asleep. They might be a little bit irritable. So you see this constellation of findings that fits into the blood deficiency category. And many times fish oils fix a whole bunch of those imbalances. So you can think of them as a blood tonic that's a nourisher, and look for those clinical signs of that lack of nourishment and apply it in that way. I think with probiotics too, you want to think of your gut and your microbiome as your spleen. That is not your entire spleen, but that's certainly part of your spleen system, both from a digestive standpoint, a clotting standpoint, immunity standpoint. It really fits into what we would call the spleen system. So your probiotics are really spleen tonics in many ways. And if you understand them to be that, then you have a better sense of like how they fit into your sort of treatment plan. So, right. Yeah.
Well, so I think this is interesting because it's kind of saying you want to make sure you're staying true to the medicine itself.
Right.
And because, for instance, you mentioned something called functional medicine. I'm not sure everyone that's listening may understand what did you mean by functional medicine? Because often people hear function, they think, is it exercise? So if you can give us just your quick definition of that and how it can be similar to the traditional medicine, I guess, if you will.
Well, right. I think functional medicine is sort of a newer field of medicine that is being developed sort of now. It's been around for a number of years and focuses on looking at whole systems biology. And so it's really very, very compatible with Chinese medicine, but the functional systems that it identifies are really more from the Western perspective. And so, it looks at things like the microbiome and gut health and really optimizing that as part of improving your patient's whole picture. It looks at the role of nutrition. It looks at missing, nutrients. And I think the differences are that functional medicine will often use a lot of lab testing to help diagnose, the exact missing sort of nutrients or the pathways that are imbalanced, and then uses oftentimes supplements as well to correct those, as well as diet and lifestyle. I mean, it definitely prizes those in the same way that we do in Chinese medicine. But it's sort of a distinct, very completely Western field of.
Right, it's definitely a Western field, but I think that's also important. Sometimes people hear the term functional, and they start thinking along the lines of more physical medicine, when in fact it's really more of a dietary and correcting the functions of the body.
Right, it's more metabolic.
To work better. So, and I think it is important for acupuncturists to maintain kind of the integrity of the medicine, understanding it from the traditional standpoint. So, for instance, for you, even as a medical doctor, do you use tongue and pulse to evaluate those patients?
I do some, I would say. I think my personal sort of strength and preference is to use visual diagnosis, and it definitely fits into the Chinese categories of visual diagnosis, looking at like skin tone, skin colors, affect, tone of voice, all of these sort of physical cues that help me make a diagnosis. And so, I do take the pulse in adult patients. I definitely look at the tongue in everybody. And I use those to sort of, corroborate my suspicions and use that information as well. But I use a lot of visual diagnosis. With kids, you don't really use pulse diagnosis. So you don't really start using pulse diagnosis until at least sort of 7 or 8 years old. They say sort of when that first cycle of Jing is completed is one of the developmental thoughts sort of in Chinese medical pediatrics. And so pulse diagnosis is not really so much a component of pediatric care in the little kids. Tongue diagnosis is a little bit more. But in the same way, kids tend to present a little more evidently. They're a little more on the surface with their imbalances, where adults tend to develop sort of layers of cover up about kind of what's going on with them. And so you need to be able to sort of see behind the scenes a little bit. And the pulse and the tongue give you a little bit of look under the hood that you don't necessarily need all the time with kids.
Right. Well, I think it is interesting, too, that you stated you may do those, but you do a lot of, obviously, observation. And I think often acupuncturists often forget that part of an examination, and maybe most of it, frankly, is taking that history and observing what you can see and making some issues just based on those, like you said, skin color, skin tone. So I think it's important to make sure they understand that that exam really starts as soon as you're conversing with that patient.
Absolutely, 100%. When they're walking in your office, you're assessing them from the minute you see them. You're looking at their affect, their tone, their bearing, and then I sit down, I go through the 10 questions with everybody. And usually by the time I'm done doing all that, I already know my diagnosis. And so then if I take the pulse and I look at the tongue, and I see something like completely out of left field, then I reevaluate. But more often than not, things are pretty consistent there. And that's definitely a style of practice. I think there is sort of, tendencies in certain, subpopulations of the practitioners to really like minimize the talking, just do pulse and tongue and treat. And that is an approach as well, but that's not my approach to.
Well, I think that's interesting because I had someone that taught me once that said that you probably are doing an exam. The physical exam is confirming what you've already observed, and you shouldn't be surprised by it because you were expecting it. But as you know, sometimes you still do it because something can come out of left field.
Absolutely.
So I would tell acupuncturists that an exam is not just always poking and prodding, but
Right.
literally observing and listening.
Absolutely.
So here's one thing is I got to ask that certainly as patients come in, they're certainly seeking you for that lifestyle change, if you will, and it's probably maybe even the whole family. What role does an acupuncturist, say when someone comes in for, it could even just be back pain, do you find as it's been a help that sometimes somebody comes for something maybe from the Western side, but then you begin to talk with them, well, what's going on with your diet? Do they seem pretty receptive to that?
Absolutely. Yeah. And very, not universally, but very frequently, people don't really know what Chinese medicine has to offer, and even what sort of holistic medicine, depending on how we want to define those, what those have to offer. So they'll come in for back pain, but they don't realize that you can help them with their sleep and digestion. And they're like, oh, and so once you start talking to them and you start saying, well, we can work on that too if you want to, then they're like, well, great, let's work on that. But they just didn't even realize that was an option. And, similarly, sometimes I'll have people bring their kids in and we're working on pediatric stuff, and, they'll be saying, oh, and I've had this shoulder pain. Can you help me with that? Like, I can help you with that. I can definitely work with you on that. And so, that patient communication with sort of all members of the family is helpful just in helping them understand like their own treatment options and the role that you can play. I think for acupuncturists and well, this is true for any medical practitioner, whether you're a medical doctor, an acupuncturist, whatever role you're playing, the role you play with a family and with your patients sort of depends on what role do you want to play with your family and patients. There are many practitioners who have no interest in really delving into people's sort of psycho-emotional issues. And there are other practitioners who really only want to deal with the psycho-emotional issues. There's some people who really want to be sort of a cornerstone of care in people's health and their family health. And there are other people who really, they don't want to develop that personal relationship with the patients, and they just want it sort of in and out. I can provide treatment, but I'm not here to become, a bonded member of your care team. And so I think people should feel free to see themselves as having a full range of options in terms of what type of care they can provide to families. And then they have to decide where their strengths lie and where their passions lie. And I think to be successful, you want to know your strengths and know what you love. And if you're doing what you love, people pick up on that. And maybe you're only treating them for back pain. Maybe that's all you treat, but you love it. You'll be a great treater of back pain, and then you'll develop a clientele and a practice based around that.
Well, I think it's interesting, your statement there, when you consider you're building a practice, as you mentioned, and patients are going to come based on that, and it just takes the time to build. You may be one that does more of one style, but that's going to draw that person and not draw the other. So there's going to be a place to fit. I always say there's room for all types of stores, 99-cent store to Whole Foods, and everything in between. You just have to decide which is yours, because that's where the patient is going to come. But it does take time. Yeah. Obviously. Now, from a standpoint, when patients come and see you, do they just pay for services? Are you doing insurance? What goes on with the patients?
Yeah, I've struggled a lot with reimbursement models because I want to be affordable and accessible, and yet I have to be able to get reimbursed and paid to maintain a healthy practice. And so I've settled on what I would call a fixed fee-for-service model, which means patients pay me at the time of the visit. They basically pay me based on time. And so anything we do during that time span is all the same price. There's no extra fee for acupuncture, extra fee for Tuina, extra fee for this or that. It's all a single price. So they know what they're going to pay up front. If they end up buying supplements or doing things like that, that's going to be extra. They never have to buy it from me. I can tell them what I would recommend they get, and they can get it wherever they want, and then it's a little buyer beware if they're going to get it wherever they want. But some people have really good sourcing or wholesale availability or whatever. And so it's a fixed fee for service. And then I do use a online portal where I can submit the visits to insurance for my clients. So people really appreciate it that I'm able to submit to their insurance for them. And then if they do get reimbursed, the insurance company generally just sends a check straight to the patient.
Right. Okay. So you're really integrating both. I mean, if a person has insurance, you're not taking it waiting for payment. They're still paying you,
right.
But then they can get reimbursed and no work on their end. So you don't give them a super bill or any of that. You bill it out for them.
I started out with super bills, and then I found there's a number of online portal services. I'm using one called Office Ally that's been it's pretty easy to use once you get to know it. And it's just such a nice patient benefit that I found it worthwhile.
Right. So, I mean, obviously people are coming because they want help, but if they can get their insurance to pay some of it, what I think is an important factor here that you've decided on a model that says I have a fixed fee. So when someone comes in, there's no guesswork. And I'm just throwing a figure. That's $75. I'm just saying that as a figure. When they come in, that's what they're paying for a half hour or whatever it is. Mm-hmm. They know what they're getting. It's not an issue of, well, what if I did this or that? And I think people are comfortable because obviously as a consumer, I'm better to purchase something if I know what I'm getting. I don't want to guess later like, oh my God, it costs $300.
Right. Absolutely. I hate the models. That's really our current hospital model is like, you can go in and you don't know either what they're going to charge you for that MRI or what they're going to charge you for the Tylenol they give you in the hospital. So you don't know if your bill is going to be like $50 or $5,000. And there's a lot of sort of manipulation behind the scenes of how much people get charged. The other thing I think about is if I have to charge you separately every time I do cups or acupuncture or gua sha, that's really a conflict of interest on my part, because then the more that I do to you, the more money I make. And so I'm more likely to give you unnecessary treatments if I'm charging you for each one, at least in my mind.
Yeah, well, that's kind of the fee-for-service model. You're paid more for what you do. If it just simply was, it's based on the time I spend with you. If I'm counseling you, if I'm doing cups, not doing cups, if I do needling. So they come in and to me, I think that's fair. And I hope that's maybe where we're going to move to the future is kind of go back to that. So people can come in, they know the price. It's just a matter of making it a fair price, as you noted, because you have to do enough to make sure your practice stays open and can pay your bills. But at the same token, a patient comes in, knows exactly what they're getting, and if their insurance reimburses. Now, I think it's something important. You just said that you charge that flat fee, which is perfectly fine. But I think it's important to note, and I asked you this before, but I'll make sure everyone knows, are you in network with anything, Doc?
I'm not. I'm out of network with the insurance companies.
So in other words, what's important for everyone hearing this, being that you're out of network, can you set your fee to whatever you want it to be?
I can. I can. I'm not contracted with anybody to tell me what I do. I think I have an obligation to charge consistent fees. Still, I don't have the same level of oversight if I'm not contracted. But I can set my own fees, and I try to keep consistent fees. And I can slide a scale if I need to for a family or such. But I try to just have accessible, fair pricing. And then most people that I see, because I think my pricing is reasonable, are happy with that price.
Right. Because they know what they're getting. They come in, they know I'm paying X dollars. If I get some reimbursement, great. Right. But they can kind of plan. And I think that's what's important for everyone here to know is by being out of network, you're not beholden to any insurance. You don't have to bill, though you do it as a courtesy.
Right.
You're not obligated to, which means you're passing that savings on to the patient because you've taken away all that additional work. And like you said, you found an online portal that's frankly easier and cheaper than doing a super bill.
Absolutely.
So I think that's what's important because patients want to know, hey, how much is it going to cost? I know that's what I do when I go to the doctor. And unfortunately, in truth, most of us choose the level of care we get based on how much is it going to cost me because we have a budget and we can't go beyond it.
That's right. It is.
So that brings me to something I think is interesting that you're talking about dealing with from insurance. And again, you get patients are seeking your care. Yeah. And obviously, I think we're going to see a little bit more. So one of the things I want to ask, and particularly because you have, such the vast medical background here, is the Joint Commission for Hospital Accreditation just, reported that they want to see more integration. Obviously, the whole opioid issue is probably prompted this. Absolutely. Where do you see things going from a medical perspective? Do you think we're going to see more acupuncture in the hospitals? Are they going to refer it? Where do you see this thing moving?
Well, I'm hopeful that we'll see more acupuncture in the hospitals, and I think it takes me into like the whole realm of the professional association work that I'm doing through the American Society of Acupuncturists at the national level, and then through the state associations at each state level too. because really a lot of medicine ends up being governed at the state level. And so there are these sort of national level proclamations that kind of occur, but the implementation of those occurs on a state by state basis. So what we really need as a profession is to be really vigilant and well set up and well infrastructured on a state by state basis so that we can be positioned to be included as a solution to fulfilling that mandate, if that makes sense. So,
Right.
the Joint Commission has said this, and now the hospitals all have to figure out what that means and what to do about it. Whether or not they include both acupuncture and specifically acupuncturists, will depend on who educates them, what the availability of those providers are, and issues like that will help them make their decisions.
Oh, great. Now, the one thing to ask you, because certainly you're involved on the national, state levels and so forth. What do you think would be the best thing for, as an individual acupuncturist, that they could do to help facilitate this? Is there other education they need to do, involvement in groups, going out speaking to more doctors? What's some things you'd recommend they might do?
Well, I think the number one thing, in my opinion, that they need to do is to join their state association. If they have the energy and desire to do it, which I hope they do, then they can do volunteer work through their state association to try to arrange the setup of systems within their states to improve the entire environment of practice in their states. So the minimal thing that people need to be doing is to join their state association, because there are so many things that we could be doing as a profession if people participated at such a minimal level. It's so important, and it may seem like, oh, it doesn't really matter if I belong. It just is so incredibly important that people belong. And the structure that we've set up to function on at the national level now involves the state associations as really the key components. That's the boots on the ground doing the work. So that would be the best thing. I think certainly acupuncturists can be, who are comfortable doing that, can get out there and give lectures, teach doctors both what is acupuncture, who provides, acupuncture, what's the training, what can we treat, how do you access us, things like that. We need that just grassroots education to be occurring. So it'd be great if people were doing that, as well. I would say those are some of the biggest things that people could do.
Okay. Well, as a medical doctor, what has been your barriers? And because obviously you deal probably more directly with other medical doctors as well, what is their fear? I don't even want to say fear, maybe that's a bad way. What is their trepidation to not integrate? Are they afraid of it? They just don't believe it? Or is it a matter of they're just not well educated?
Well, I think it's all of the above. It depends on the doctor that you're talking to. And I think that, some doctors really absolutely know nothing about acupuncture or Chinese medicine. And so they just need basic education on acupuncture and Chinese medicine. Some doctors, they believe in acupuncture. They've seen the research on acupuncture, but they don't know who to refer to, and they don't know how to identify a qualified practitioner. So they would if they knew that, and then I do think that a barrier that we still have is doctors who even know about acupuncture and know about referring to a licensed acupuncturist are concerned about the reimbursement. And that is still a problem. And in many places where reimbursement is out of pocket, a doctor can desire all that doctor wants to refer a patient, but if the patient can't afford the care, it becomes a moot point. And so, working on finding reimbursement streams for the profession is a very, active line of work right now. And I think the opioid crisis, presents us with a really valuable opportunity to showcase the potential benefit of acupuncture and Chinese medicine in solving the nation's most active, health crisis right now. That's at least the most, in the public eye. And saying, if we could really integrate this care into the country, we would save the country money, and so, we need to stop looking at this as, it's expensive to integrate the care. No, it's like it's expensive not to integrate the care. And once all of those pieces start coming together more and more, I think we're just going to see more and more doctors doing it. And then realistically, like doctors are people, before anything else, and they respond the same way all people do, is that when their patients and their family and their friends are saying this was beneficial to me, they're much more open to giving it a try. So, as they get exposed to it, and as they have patients coming in and family members saying, acupuncture was really beneficial for me, that it sort of, exceeds the PR that our industry could ever give it, is to have that patient saying, this was meaningful for me. And
Well, one of the things I always push is when you have a patient that's been the medical route, quote unquote, and they've come to you and help, you should often write a letter to that medical doctor, just kind of indicating what went on, what you did, and then maybe something from the patient so that they're aware of it. Because I find medical doctors want their patients to get well just like everybody else.
absolutely.
They want to have the available tools. So now, would you recommend saying, how do I get a hold of, how do I educate? Should it be something you just look for doctors in your area and write a nice letter explaining your background, what acupuncture can do, and seek referrals? I'm assuming you'll get maybe a lot of non-responses, but at the same token, how else are they going to know you're there until they get something from you?
Absolutely. And so, the two avenues on that are sort of the cold call, where you do send that letter just introducing yourself, saying, hey, I'm in your neighborhood, I'm in your area, please consider me for this. And it's ideal to sort of give them specific types of cases that you'd like to be treating, or so they know how to think of you and how to contextualize you. But there's also the opportunity that if a patient comes in and you treat that patient, and especially, not only, but especially if you have a good result or if you have a concern or something like that, that you, with the patient's consent, write a letter to their doctor and say, Dr. So-and-so, I've been seeing your patient in my clinic. We've been doing this. These are the outcomes. These are my questions. And if I can be of service, please let me know. Doctors will read letters that are referral letters or response to referral letters about their patients, or patient-specific letters get read. Cold call letters, maybe or maybe not. But, anyone who comes in who's got a doctor, if you want to integrate with that practice, you're going to have a lot better uptake.
I think it's interesting because, as you know, patients are coming to you specifically. They try the medical route, which I would believe that most acupuncturists, they're not getting a patient that's solely saying, oh, I never went to any doctor, I'm just going to acupuncture. I'm not saying that couldn't happen. But realistically, I think we need to seize that opportunity to make sure that we're letting people know. And when I say let people know, meaning they're doctors who become aware, because like anything, when they become aware of it, I think there's a greater chance they're going to seek that as one of the tools. Says, hey, look at this outcome. Right. And I think that's where acupuncturists are missing out. And probably what I would recommend is they should list to them saying, hey, and if his insurance is a barrier, here's what we've done, like your model.
Right.
Or make sure to send them a list. Say, here are the plans that I have found that covered, but be very specific. Aetna covers, but it's very limited. Or Cigna, ones that are better, letting them know so they can kind of have a feel for it. And then that way, no one's probably guessing. They can say, okay, good, is this covered or not? So if someone comes in with eczema and they have Aetna, I'm going to tell them right off the bat, not going to cover it. Because that's the way. But at the same token, if you have someone with health partners or a lot of the Anthem policies, they will cover emotional issues. They'll cover eczema, things you'll be surprised. I think most people are shocked when they hear the companies like United Healthcare and under the blues will cover asthma for acupuncture, but they're not aware of it. And again, not that we're beholden to that, but we want to give an opportunity. So I think it's important. What I would love to see doctors take away from this is look at how you've integrated this in. You've made a simple model. Patients come in, they pay a flat fee based on time. So if someone comes for 30 minutes, I'm assuming it's not as much as if they came for an hour.
Correct.
I think everyone understands that if I get a 30-minute massage, I know I'm paying less than if I pay for an hour massage.
Right.
Everyone accepts that, knows what they're getting, and you integrate that way. But ultimately, people are seeking your care, and they're willing to pay for it so long as they understand it when they come in.
Absolutely. And I really encourage people to list their prices on their websites. Like, that should not be a mystery. Pricing should not be mysterious. I really disagree with models that try to sort of trick the patient in the door and then do this and that. I think the consumer nowadays, they want to know upfront what the cost is. And if for whatever reason you're not comfortable providing that, that just adds a level of it's a trust issue that happens there. The other thing, if I could throw in, there is a company called AccuClaims that will do insurance verification for you. It's a $10 fee per verification. I mean, this is all stuff you could do on your own, or theoretically the patient could do, but they can just sort of do it. And you can either pay that $10 out of your pocket and say, it costs you doing business getting the patient in the door, or you can say, to patients, look, for a $10 fee, I can get your insurance verified, and we can find out if you're covered. And if you decide to come see me, I can deduct it from your, the cost of your appointment or something like that too.
Okay, so one of the things I think we're looking at, Doc, here is that coming up with a good fair fee. And I teach coding and billing courses, but one of the things I start with is that you need a certain fee to keep your practice open. And my point is, most often, you're better just to come up with a fee, and whether you have or don't have insurance, that's the fee. It's simple. So if I can get 20 patients with insurance for $75 a visit, or I get 10 that, I just want the patient and I want insurance to help. Don't get caught up in overcoding. I got to code for this set. Just code based on when the patient comes in, this is the fee. And then you can make it just one. If you want to code an office visit, you want to code the acupuncture. But again, when you start getting into individualizing things, that's where things become problematic, because now it becomes an issue of, well, wait, did I do this? And as you mentioned, that incentive. So again, I go back to, I think you've hit the right model. Come up with a fair fee. This is what it costs to come in. It's time-based because you're time-oriented, and whether I spend time with you more counseling or more acupuncture. So I would assume, just as a quick note, do you mostly bill office visits? And when I say office visits, I want to make sure everyone knows I'm talking about evaluation and management codes.
So I do bill evaluation management codes. I'll also bill like 97810 on those codes. I'll bill acupuncture codes, and I'll bill 97140 number times 2 manual therapy codes sometimes. You have to know based on your own practice, what you're allowed to bill. And what's sort of legal in your state. The other thing to be cautious with some of the manual therapy codes too is that because patients often have a set number of limits on the use of that code per their plan per year, many of them will not want you to use that code to bump up the reimbursement or whatever from your visit. They want to save it for those therapy visits, because the physical therapy visits are oftentimes much more expensive, because if they're being billed through the hospital, or however they're being billed.
Well, sure. It's important to know you may have 20 visits a year, and if you bill 97140, it takes one of those visits. Now, some patients may say, hey, I'd rather not. But again, if your fee is fair, you're going to say, hey, look, this is the fee, and keep it straightforward. And I think it's important to know your state, know your scope of practice, because each state, as an acupuncturist, may limit the types of things you do. Most states allow acupuncturists a pretty liberal amount of scope of practice, but do be aware. And when you said manual therapy or tuina, that pretty much fits within that. I do want to have offices be careful. Regular style cupping would not be considered manual therapy, so don't hide that in there. It's got to be a real manual therapy. Cups wouldn't be that, nor would Moxa. Nothing against those, but just make sure with coding, you can't code something that's approximate. You have to code it exact. So if it doesn't fit it exactly, then you have to code it unlisted. But again, if you come with a fair fee, it's whatever dollars, patients understand it. Ultimately, it's a matter of getting patients in the door and getting people understanding and seeking out your type of care, and you will build on that. So now, Doc, I want to conclude and say thanks, but also, is there a way for them to get information from you? I think you have a website or some areas where you do some teaching.
Absolutely. I have 2 websites. One is my main practice website, which is just www.eastwestintmed, as in integrative medicine, intmed.com. There is some resources on that website too, and a link to my other teaching website as well. My teaching website is through a group called Integrative Medical Network. So it's www.imn, as in Nancy, education.com, imneducation.com. And it's a subscription website, but it's a free range subscription, and so people can log on and they can watch any of the videos on there. And I have recordings of some integrative channel theory. There's some information on vaccination. There's some information on Chinese medical pediatrics and developmental theory, and I'll continue to add to that website as well. So if people want to follow up with some interesting, hopefully educational stuff, they can find it there.
Okay, great. And no one panic if you're listening and didn't catch those. There's a printed version of all this, so you'll have all that up. That'll come up, so you'll have no problem. There's going to be a printed version. And so I think it's important to know, this is one of the reasons we bring you this, is we want to help your practices grow, help you help more patients and integrate. And I think the move that we both have seen, of course, is integrated medicine. There's now an understanding that you can't have one, but it should integrate all these things that can be helpful to a patient. There shouldn't be an exclusive of anything but what's going to help the patient. I think it's important to note, acupuncture almost always helps. And I think sometimes people forget that tool end of it. It may not be the end all be all, but it's an important component that is often left off on the Western side because it's just simply something they don't deal with as much, hence why people are coming to you. So it's important to get in, integrate your practice, get people to understand what you can do and what you specialize in. And there's nothing wrong with you specializing. Hey, if I want to do just pediatrics, why not? There's a patient base for that. Or if you want to treat adults, it's a matter of setting those parameters, doing it well, and people are going to seek us out.
That's right. Absolutely. Right. So, offer good quality service at a reasonable price and you'll be successful.
Yeah, exactly. Good quality service. That's number one. Reasonable price. People will come back, because I generally will say people buy what they want. and beg for what they need. And often when people have insurance, they think they need care. But with you not doing that model, they want it. They've already purchased it. And if the insurance helps to pay, it takes some time to build that.
Absolutely.
But it's certainly a way to go. And I think we're kind of moving away, because I think of it just as myself. When I go to the doctor, I want to know what's going to cost me, or I'm nervous as to, can I afford this or not? You've put yourself in a position that you don't allow insurances to dictate to you. You dictate. And if it does cover it, does. If it doesn't, and you're going to certainly have some patients, because they have so much, maybe they don't want to come to you, but at the same token, once they learn you will send a bill on their behalf, they're going to say, well, wait a minute, maybe I will.
Right.
So it's an important factor to kind of understand that. But I think it's good to kind of take into account that here's a medical doctor that's doing acupuncture. There's a reason for that. He has found that alone may not be the end all, but it's a combination of that patients are seeking out, that he looks at the body in that holistic way, which I think everyone listening does as well. And it's just a matter of saying, how do I make that work for me and work for my patients and ultimately make a living, if you will. So, Dr. Miller, I cannot thank you enough. I think this has been informative. I will encourage everyone to please take a look at his site, follow up there, see the information he has. But take heed to the information. Here's a successful doctor, been around a while, and notice how he's done it. And you can set the parameters. You can be successful at anything if you're willing to take the time to push that issue. So we at American Acupuncture Council want to be part of that. We want to make sure you're successful, quite frankly. We have a vested interest in you, because the buildup of your success is ours. So I'll just mention to you, Doc, I just came from a meeting of WHO on ICD-11.
Great.
There's going to be a separate chapter for traditional medicine in the next upcoming ICD-11, because it's being integrated, that they're realizing that to integrate this is a needed resource, because it's very inexpensive. And it also has a good result. And ultimately, if you even think of insurance, they want the same thing. And so I think we're moving at probably the best time to be an acupuncturist is now, because of the acceptance. It's a matter of, are we prepared as a profession to accept these patients with a good understanding of how to use the system, quote unquote, to make sure it's the best benefit for the patient.
Right. Absolutely.
Yeah. So again, thank you, Doc. I love that you had some time with us. I'm really excited to hear all the feedback from this, but I think it's going to give someone an interesting perspective. The takeaway for me today, though, if we're going to continue to grow as a profession, please join your state association, because the way to move forward, not to say they won't want to do things individually, we've got to move as a group and begin to push, so that will become a little bit more of a political power. That may seem foreign to some, but ultimately that is part of it. And so please take Dr. Miller's advice, join, get in there, and if you can volunteer time, all the better.
Hallelujah.
Okay, so thanks, Doc. We appreciate it.
Thank you
we'll
so
talk
much.
to you next time.
It's a pleasure.
And we're so appreciative of your time. And we want to make sure you always know the resources available from the American Acupuncture Council. You can go to our website. It's aacinfonetwork.com. We offer a variety of services. We do seminars all over their continuing education. So just check our website, look for the location near you. We will be having our January or next year's seminars will be up. We still have more for this year that are left over. In addition, we offer a network service. The network service is where, once a member, you can join and give me a call. You have any issue on coding, billing, documentation, medical necessity. Once you're a member, you can call me 10 times a day if you need to, or email me. But we want to make sure that you're getting reimbursed properly. And we also offer our digital coding. The digital coding is nothing more than a code manual. It has CPT and diagnosis, but it updates continuously. So in other words, when we just had the update to coding this past October 1st, it updates automatically, so you don't have to buy anything new. So take some time, go and take a look at the value of the services we have, again, because we're your partner. We want to make sure you're successful. We will do your malpractice insurance all the way through making sure your practice is successful.